Okay, we are ready to get started. Good evening, everybody, and welcome to this month's session of Connecting Parents, where we're going to talk about um, PANDAS, which is a condition that many people may not be familiar with. We know it's also very much misunderstood, and so we're going to get some information tonight about this and how it's impacting children and, by proxy, families. We are going to also have Wordly available for people who are interested in translation. So please know that that information is included in the chat. And after I introduce our speakers, they will do their presentation, and we're going to ask that you either put your questions in the chat or just hold on to them until after they finish presenting. All right, so we really very much appreciate that. And again, if you need interpretation services, those are included. The link is included in the chat for you to use. So without further ado, I'd like to introduce our amazing speakers for this evening. First, we have Melissa Glynn-Hyman, who is a licensed independent clinical social worker with over 15 years of clinical experience providing counseling and therapeutic support to children, adolescents, adults, and family. Melissa received her master's in social work degree from Simmons College School of Social Work and further specialized training in cognitive behavioral as well as EMDR therapy for the treatment of anxiety disorders, depressive disorders, PTSD, and conduct disorders through the Judge Baker's Children's Center and Harvard University. Prior to graduate studies, Melissa worked in the residential care facility for adolescents and then in a protective services program for the elderly. For over 10 years, she has worked in outpatient mental health, focusing on individual, family, and group therapy for children, adolescents, and adults. Melissa has provided community, home, and school-based interventions, as well as have served as a liaison within elementary schools. Currently, Melissa maintains a private practice in Brookline. Personal experiences with Lyme and PANS led to Melissa's initial exploration and understanding of the disease and how it affects both the person living with it and those among them. She joined the New England PANDAS Association in 2014 as a co-vice president to advocate, educate, and help families to gain access to resources and support. She is honored to now have the opportunity to combine her personal experiences and clinical expertise in cognitive behavioral interventions to provide individual, family, and group psychotherapy. So please join me in welcoming Melissa. Along with Melissa, we have Peggy Chapman, who is a clinical nurse specialist, board certified in child and adolescent psychiatric nursing. Peggy received her Bachelor of Science in Nursing at Creighton University in 1976. In 1982, she graduated from Boston University with a Master of Science in Nursing and was certified as a clinical nurse specialist in 1983. She has worked with various capacities in the Omaha and in the Boston areas as a nurse manager of child, adolescent, and adult psychiatric units. She has been a child, adolescent, and adult therapist and has done psychopharmacology for all ages since 1998. She is the medical advisor to the New England PANDAS Association, a psychiatric consultant to Dearborn Academy, and the co-owner of Bridge Consultants, which specializes in the diagnosis and treatment of neuroimmune psychiatric disorders. She treated her first patient with PANDAS in 1998. So please join me in welcoming Peggy. And last but certainly not least is Lisa Grisolia. Lisa is one of the founding members of the New England PANDAS Association. She helped create and execute the vision for the board. Lisa started the first PANDAS support group in Massachusetts back in 2008 and also facilitated the South Shore Lyme disease support group. Lisa is a board-certified medical esthetician and educator. Currently, she is majoring in natural science at Quincy College. She has 2 children diagnosed with PANDAS, as well as a grandchild that is autistic. She is dedicated to assisting and increasing education on this disorder. In the past, she has helped, along with many other committee members, to plan the New England PANDAS conferences and doctors' functions. So please join me in welcoming Lisa as well. So we're really excited to have all three of you here to lend your expertise and experiences. So the floor is now yours.
Well, welcome everyone. Thank you for coming. So I'm going to start first by just trying to briefly give you an overview of what is PANDAS and how we think about it. I cut a lot of screens out that were about treatment. That would be another whole half an hour, 40 minutes. I'm going to give you a brief overview, and I also did not include a lot about the current research. I'll mention a little bit of that. So going forward, we're going to talk first about New England Parents Association as to where raise awareness. Oh, Lisa, you're going to say something, right? Do you want to do that? Did you want to do that? Anyway.
Did you want me to, I'm sorry, to say something about anything?
Did you want to say anything about the PANDAS Association first?
Yes, we're just a group of medical and parent volunteers that have been really spreading awareness for the last decade. It's our 10-year anniversary actually this year. And we are just grateful that you have us speaking today. And we are here to just really create awareness and create change. And also all three of us are also on the, we sit on the board of the Department of Public Health on their PANDAS Advisory Committee. I'm not sure if that was any of the bios. And so we're really still committed to helping and, forging bonds with other nonprofits that are either local and national, just to keep updated on what's going on in the community and beyond.
Thanks, Lisa. So the goals of the presentation will be, what is it, the historical perspective, how is it diagnosed, and identifying some of the neurobiology behind it, a little bit about the treatment course, and then Lisa and Melissa will talk more specifically about the educational and family supports that are really important in this illness. So first of all, there's a long history of infections causing psychiatric symptoms. You all now have become familiar, I'm assuming, with the most recent one, which is COVID, down here in the middle. But originally it was syphilis and other things, and then Bartonella, which is also called cat scratch disease, and also by ticks and lice, fleas from cats. Spanish flu, which was the original kind of SARS type virus, had a lot of psychiatric symptoms. About 20% of people were noted after the flu in the Spanish flu to have major psychiatric issues. Similarly, the same numbers with SARS. There's another one that's called HER-W that shows up a lot in brains of people with schizophrenia. And somewhat groundbreaking 2 summers ago or summer ago was a major article that came out that most people are not familiar with, about having identified in over 1 million veterans that it appears that Epstein-Barr, which is mononucleosis, is now linked to having MS. Now, that is not that everybody gets MS, but that it is probably the trigger for some people. What are these two things? Pediatric acute onset neuropsychiatric syndrome. That is the overarching category, which PANDAS, which was the original diagnostic category, was stated. The difference is this one is specific to being started by streptococcal infection, versus this one is other things besides strep. So pneumonia, tick-borne illness, COVID fits under the bigger umbrella. There are conditions in which a subset of children and adolescents, and we also believe adults, certainly in COVID, you see this in adults, experience an inflammatory or what's called encephalitic brain symptom secondary to the infection reaction. It's not the infection itself always the cause of the problem, as in COVID. It's the antibodies that get misdirected from trying to fight the illness. They go to the wrong place, particularly the brain. That then causes psychiatric symptoms. Those antibodies is what causes the problem. But the original source of those antibodies is whatever infection, viral or bacterial, that is creating the response. Herpes is another one I forgot to mention. So just to say quickly, this is the basal ganglia. And you'll see it's connected to all sorts of really important parts. The frontal lobe of your brain, which your thinking is, your auditory system, your vision and smell, and your memory, and your fight, and your limbic, which is your emotional system. And most of the problems in PANDAS strep emerge from this area. But in global things, in Lyme, we know from some of the work that Johns Hopkins is doing, it's a global inflammatory problem when you're having symptoms. So again, you have an infection. The antibodies are designed to find the enemy and attack it and get rid of it. But in strep in particular, the basal ganglia tissue that I just showed you, this blue, is to the antibody, it looks like strep. There's called cell mimicry. So it attacks the basal ganglia, which sets up a dysfunctional basal ganglia. It gets inflamed. And you'll see in a little bit later how the neuron tracks that go through that area, it's like the central train station. So when that gets disrupted, all sorts of symptoms can occur. PANS and PANDAS is a diagnosis through clinical evaluation. You have to take a very careful history to know what's going on. And labs are supportive of the diagnosis, but they do not diagnose this illness. The average age is 4 to 19, although the majority is in 4 to 9. But no accurate epidemiology has been done in studying this, which is one of the big problems we suffer from. We think there are far more older kids showing up in our offices for treaters because they've actually been struggling with this illness for a number of years when you go back over their history. They often are 14 to 18, 19, 20, but when you get the history, they started having problems maybe 4, 5, or 6. It's a spectrum, so just like autism, there's lots of different presentations and different triggers and symptom mixes, which causes enough problems for diagnostic correctly. Very importantly, as an autism, for those familiar with that, immune issues are very high in these families. That would mean your family might have a history of rheumatoid, lupus, autoimmune thyroiditis, which would be Hashimoto's or Graves' disorder. So there's a lot of immune vulnerability in these families. And can adults have PANS? Yes, we believe they do. It's very poorly recorded. It's very recorded. You know, people often have these long stem OCD symptoms that come and go. They don't realize when they're sick, it might make it much worse. There was a 26-year-old who did suicide. Her brain was donated by her parents to a brain bank now called PANDAS in Georgetown University. And the result is when they looked at her brain tissue, the tissue was damaged. We don't always say that it's damaged beyond control. This was an untreated. She had just been diagnosed and just had prepared to start treatment when she died. So, and this was an extremely successful girl until she got strep while she was at her university. And so she was in college when things seemed to start to unravel. It's a sudden onset in diagnostic criteria, and that criteria is going to make a comment about. It's either a sudden onset of an OCD type behavior or a sudden onset of food restrictive food intake. This is the food intake diagnosis has kind of gotten a new name called ARFID, avoidant restrictive food disorder. And it has whole new systems set up in Walden and Children's and Mass General. There's new clinics opening for this disorder. We wish it was all of those children and were checked for infection, which is not just standard treatment right now, because we believe a lot of them, in fact, are responding to some infection or virus. It also has to be accompanied by 2 of the following I'm going to go through, but I want to asterisk this word acute. Acute onset is really hard to say if you start to become really disturbed at 13, and up to then you might have had some anxiety, you might have had some learning issues, you might have had a declining academic performance, but that was chalked up to divorce or bullying in middle school. Numbers of things can fill in the blank as to why you're having those problems. But when we go back and trace each event in their life and we can look at medical records and remember from the families, it's often an onset that starts when they're earlier, but there is something cascade-wise that sets it off. So it's very common that an illness or an infection, or even, well, COVID is a good example. We've had a number of kids just kind of really lose deep psychiatric symptoms that never had them before with COVID. And not just the brain fog fatigue you hear about with a lot of COVID. But when you look back at their history, there's been other insults of infections along the way. There's been repeat strep infections when they were younger, or a concussion, or an injury, because all of those are inflammatory. If you have psoriasis or eczema, that's an inflammatory illness. If you have a lot of allergies, those are inflammatory. So one of these 2, and then these are the other ones that it falls into: anxiety, depression, so mood changes, sensory issues. These kids all of a sudden, and young adults, can't stand sound or light or clothes or sensory smells. They all of a sudden complain about chewing at the home table, where it's called misophonia, where they can't stand chewing. They have all sorts of sensory issues. This is also reported in COVID, and it's also reported in chronic fatigue fibromyalgia. They share a lot of things. Motor abnormalities, particularly tics, which is abnormal involuntary movements. But they also get very hyperactive physically. They like to pace, they jump, they run, they hit, they break, because they're full of adrenaline and it just has to be expressed. They developmentally regress. They have lots of baby talk. They have, somebody said to me today when I was convincing the mother just an hour ago that they needed to try and go to bed a little later. They were trying to put their 9-year-old into bed at 8 p.m., which then she didn't fall asleep till 9:30, which would be more appropriate. But she said, well, I think of her as 4 years old. So she was translating that to what time she should go to sleep. And she realized that that was not what was really happening. They often suffer great deterioration in school performance. It tends to affect math skills, science skills, which are visual motor, writing, which is motor skill, dysgraphia, and sometimes everything else, because they also have executive function problems. So writing a paragraph is often impossible to them. And they also suffer with processing speed. So things are no longer flowing very correctly. Somatic symptoms are rampant. They do not feel well. They often have gone to GI specialists. They've gone to heart specialists because they have heart racing with secondary symptoms. They have rotating pains in their joints and their backs, et cetera. They're often reporting they don't feel well. But again, when you have an anxious child, everybody chalks up your stomach ache to anxiety rather than something else causing that problem. These are pictures of what it would look like in some of the expressions. So this is before and onset. This was a late middle schooler, I believe. Very beautifully written, drawing on a drawing that was given to her or him. And this is what they did when they tried to write an assignment under the flare of the PANDAS. This is under symptoms. Here's another example of before when they were regressed. They had a very childlike, this would be like a 4 to 5, 6-year-old maybe drawing, and 6-year-old, 5-year-old, you'd see digits in their hands. You'd see much more body shape correctness. And this was all over the place. This would be what she drew afterwards, after she was treated. So this is the basal ganglia. Again, I want to point out a couple things. So the cell tracks called dopamine, which are focus and attention, reward, mood, all dopamine calls all movement. So eye blinking, swallowing. When a person has Parkinson's, it's a deficiency of dopamine because you can't move your body correctly. If you have Tourette, it's a dissociation and a dysfunction of dopamine. So these are dopamine tracks, and they go all through the basal ganglia. So they can affect all these different areas. So some people have more cognitive issues. Some people have a really emotional dysregulation. And here also sits psychosis. About 10 to 13% have psychotic. We have motor learning. We have tics. We have sensory issues. So because of the nerves and how they work, and the basal ganglia being kind of zone central for all transmission, it very heavily impacts globally the brain. And I mentioned that just here. And learning problems are also huge in these issues because they start to not do well. And when we look really carefully at old testing, if they have academic testing, you see these wild changes in their test scores, which people chalk up to, oh, their parents got divorced, they're anxious. It doesn't work that way. It is, you don't lose 50 IQ points because your parents got divorced or you're bullied. But that's what you see, and everybody's just going to be chalking it up again to the psychiatric situation that they've got. So there are two chemicals I'm not going to limit this for you to go through, but pay attention to norepinephrine, which is also adrenaline. They have a lot of dysfunctional adrenaline and they have a lot of dysfunctional dopamine. So learning and physical is what adrenaline is knocking into. The also thing is they have extreme compulsions at time. We're talking about licking, barking. Well, barking's a tic usually. They can't get dressed. They can't go out the door. They can't leave their mother's side. So their mother is now trying to bathe and they have to be in the bathroom with them. Or they can't shower without their mother practically in the shower with them. They're terrified of something bad happening. They can't often express it. They're like deer in the headlights. They can't often put words to this. The parents are the reporters. The kids are lousy to interview when they're in this message. I don't even count on them telling me the truth because it's so foreign to them. It's like some body snatchers taking over their brain. So it's diagnosed with, as I mentioned, the history, but the lab reports support it. So we do swabs for strep. We do blood work for evidence of strep. We check other illnesses. This is the treatment model. I don't have time to go through the major details, but basically you're treating 3 areas. You're treating the symptoms through psychoactive medication, psych meds. It says in the guidelines, cognitive behavior therapy, but all of us would probably agree in the front lines, you can't do therapy when you're in this position in your head. You cannot reflect on yourself when you don't even know who you are anymore. That's a major mistake that I believe was put in this because they believe that because like OCD, you can use that. Doesn't work in this until their brains are calmed down. You use antimicrobials, which would be antibiotics, and things like Advil and Aleve all the time to bring down inflammation. And then higher levels of anti-inflammation include what you might hear about the IVIG, which is intravenous gamma globulin, which is a special treatment to regulate the immune system. And you also do higher meds. There's something called rituximab. Some of the meds that use for rheumatoid arthritis, for example, are being used for these kids downstream if they don't get better on the earlier side.
Peggy,
They
you
have
have
relapses.
minutes. You have
Thank
5
you.
minutes.
They have relapses a lot, especially the older you get them, the more compromised their immune system is. I also didn't mention mold. So there are two categories we, as three of us, feel are very big immune disruptors that are often not looked for in the general PANDAS clinic group. But mold, which is very common in New England, everybody's got wet everything. Even if your house wasn't wet when you moved in, it might have been wet before you got there. And mold is really a toxin to your immune system, as is tick-borne illness. They are immune disruptors. They burrow into your organs and your tissue. They don't always appear in the blood to accurately measure them. But they are immune disruptors. They're constantly agitating. So too can allergies be. So too can tonsils that are filled with gunk that are still sitting in your mouth, continuing to agitate your immune system. These are some recent researches. I just want to bring attention to a couple of these. This is 14,000 cases in Denmark they studied. All this was that if there was an infection, they in Denmark and Sweden, they track everything you ever do in your medicine because this is the National Health Service. So if you get a prescription for an antibiotic, they know that. And then they track that later on, you actually have found that about 20% of people develop a psychiatric symptom that they did not have within 6 months of that antibiotic order. That's pretty stunning. Similarly, there was the first one is about COVID symptoms and after severe bacterial infections. There's several articles here. But this is what's really starting to be shown as epidemiology starts being shared around the world. And once COVID came in and this whole issue of mono being virally maybe induced, they've always thought it was virally induced, you just know what. But people are now more interested in whether schizophrenia, bipolar, mental health are in fact caused by illness. They're revisiting this issue, which was thought of pretty commonly as probably connected before with the age of penicillin and Freud, who redesigned how we think about illnesses. Eating disorders, similarly, there is a fair amount of gut bacteria issues you've heard about, but there's also issues about eating disorders related to infections in the literature. Not as much, but this is an area. And also they know that some of the basal ganglia, which has multiple different parts, the frontal striatal is part of it, has something to do, for example, with binge and bulimia. Roadblocks to diagnosis, I mentioned, many practitioners, including a lot of pediatricians, do not understand this. They were taught about PANDAS, but when you start to think about PANS, they don't know what to do. They can't do it. Many people still say it's controversial. They know anything to do with it. They don't diagnose it. Unfortunately, the American Pediatric Association has yet to give an opinion about this. They have so far been questioning it. To us, who's in the field of this, the science is very strong. COVID is very strong evidence that if you have an infection, you can have a major serious psychiatric issue. A number of adults have been psychotic and suicided after COVID that never had a psychiatric problem before COVID. It's not just the trauma of having COVID. And also the symptoms can wax and wane. Again, we blame all sorts of other reasons for why people are all of a sudden different. Mothers are often blamed for their child's behavior frequently. We've had people in the emergency rooms within the last year whose child was ticking like crazy, and the mother was told it was her OCD that caused this. And these are Mass General Children's Hospital level cases we're talking about. And I mentioned the doctors. This is a very interesting article, unfortunately, about the fight between the neurologist at the American Peds and the PANDAS people that keeps going on and on. That's Gilbert and Meg down there. And I'm going to turn it over to Lisa. Lisa, you want me to just keep moving the screens, or you want to take over?
We'll have you take over the rest of the slides after I'm finished.
Okay.
Hi, I'm Lisa Grisolia. I'm a parent that I actually just like to share my story so that other people understand what it's like to go through having a child that has PANDAS. My daughter was a 7-year-old when her personality completely changed. She went from a happy-go-lucky little girl to a paranoid girl or paranoid child with unrealistic fears of tornadoes. It was so bad she couldn't be near the windows. All the shades had to be closed, and she would not be able to leave the house if it was dark or raining. This happened overnight. I also had to have her seat in school moved away from windows, and her fears were real, and they were real to her and severe. She was having full-blown panic attacks. She was not only having obsessive compulsive thoughts, but she was also cartwheeling uncontrollably and nonstop, like she was driven by a motor. So she had severe separation anxiety from me. She was starting to hoard food. She was wetting the bed, hallucinating, pacing around my house at night and not sleeping. Or when she did sleep, it was in bed with us. She had sensory issues. She had trouble with her socks and pants, and just the feeling of them on her skin would bother her. I brought my daughter to school crying every day. I was calls from the nurse also every day, and she would most definitely come home. I was very lucky that I didn't lose my job. I was able to get her and bring her to work with me, where she had a safe place where she could be while I worked. There was a really bad rainstorm, and she was so distraught that she stated she wanted to die and that she wanted to jump out the window. I immediately brought her to the hospital. That was a red flag for us. And when we saw a physician who stated to us that she thought that she may have PANDAS. They did a rapid strep test and it came back negative. I did not realize that she was already on an antibiotic for a urinary tract infection that could possibly mask the results. And I conclude now that maybe this is what happened. She had also since had reflex surgery on her bladder, and she had had a lot of reoccurring urinary infections from the issues that she had. We followed up with her pediatrician, and her pediatrician put her on adult doses of anti-anxiety and antipsychotic medications, so high that the pharmacy called us because they were so concerned. In my opinion, these medications contributed to the hallucinations she was having. I had no knowledge or any experience with these type of medications before, and I was just listening to my doctor at the time. I poured over case studies on the internet. I kept looking up what PANDAS was. That's all I could find at the time. 2 months went by, and we had no changes. So I contacted that emergency room doctor again and asked her if she could pull a blood titer to check the strep in her system. And she had an elevated titer. She was able to get her on antibiotics. And it took about another 1.5 years of a low dose antibiotic to just see any type of results. At that time, she had already seen at least 5 therapists, 2 psychiatrists, a neurologist, and 3 pediatricians before even being treated properly for this. I feel like she lost 18 months of her childhood, and she got about 70% better for just about a few years. And she had anxiety, but it was enough to manage and get her to school. Then when she was 14, she got a cellulitis eye infection, and both eyes were swollen completely shut. And this was after she had gotten the HPV vaccine. It was so severe that she was sent by ambulance from Rockton Hospital to Children's Hospital in Boston. She received the strongest IV antibiotic to control the infection in her eyes. She had pockets of fluid in her eyes that required surgery. And this is when we started reliving the nightmare again. We honestly thought that antibiotics had treated her problem and that we would never be here again. But all of her major fears and anxiety came back. She thought her teeth were falling out. She thought that her appendix was bursting, and she was having chest pain. We went through EKGs, x-rays, ultrasounds, and finally a pediatrician suggested seeing someone at a mental health facility. I reluctantly took her there because I knew if I didn't, it would be a good situation for me. They separated us by a locked door and had an evaluation with her, and then they brought me in. I knew my daughter didn't belong there, but maybe she did. At the time, she was having such bad issues, we didn't know what to do. It was so difficult to just witness your child decline like that. You wonder why, and if this would be for the rest of her life. We started back on our journey with PANDAS, and thank goodness I had started a support group in the midst of all of this to ensure people wouldn't feel so alone, because I needed these people and their new resources now. When my daughter first got sick, it was 2005. So there were no resources anywhere on the internet, only case studies. So it was a really lonely time. She had since been treated again for strep, and now she was tested positive for Lyme, Bartonella, ehrlichiosis, which are all co-infections of Lyme, mycoplasma pneumonia, and she also has POTS, which is a post-autonomic. I'm sorry, my words aren't coming for that.
Tachycardia
Yeah,
syndrome.
saying tachycardia. So basically, she her blood pressure doesn't come up from sitting to standing. She had also had neck swelling with antibiotic treatment, and that's gone away. They think that she was a strep carrier with she didn't have typical symptoms. I feel as if strep and Lyme have both been culprits in her illness. She missed 46 days of her junior year of high school from being ill. She's now 25 and she's finally doing better. She does have anxiety from time to time, and has also been diagnosed with anorexia. And she does still have some setbacks, but we're still hopeful that she will continue to be better and just stay that way. I also have 2 other children, one that was diagnosed with Tourette's and PANDAS, and he has since gotten better without any long-term treatment. And the other one was diagnosed with a muscular disorder. I also have 2 grandchildren, one that's autistic, and one grandchild that after virus recently presented with some of the same symptoms of PANDAS. So this is why I'm still here. I'm really thankful that people are here to learn more. And there are so many difficulties that we faced along the way because it's often misdiagnosed or overlooked. And many healthcare professionals are not familiar with the condition, which can delay the correct diagnosis and treatment, as well as just being stressful on the whole family unit. And families need support. And I'm just so thankful for anyone that's here just to learn more. Thank you.
One comment I want to add is when I first met Lisa, watching her do a presentation, she brought a stack of prescriptions that she had been given.
I found them.
Did you? And it's about 3 inches high.
These are
That's only part of them.
That my daughter was on during like the first 3 years. And I found them recently. It's a
And what happens is kids go around to psychiatrists or mental health provider and doctors, and they collect diagnoses, often sometimes inappropriately given, like autism all of a sudden at age 10 or 12 when they didn't have it at 6 or 10. They also get hopeful that the next pill will help when it fails. So they become then known as treatment resistant, which again often boomerangs back on some kind of family problem that's causing this issue, that you're not trying hard enough, you're not giving the right resources, you're not showing up for your therapy. Another phenomenon of a lot of these kids is their therapists discharge them from their care more than the average amount because they're not getting better, or they've tried to suicide and the therapist wants out. So those are some backdoor but very important, devastating things that happen to the parents on a regular basis.
Thank you, Peggy, for reminding me of that. I found them today. I was looking for them. I'm like, finally found them. So I'm going to pass it off to Melissa Glynn-Hyman. Thank you.
Hi, and Peggy, will you just go to the next slide?
Yeah.
Thank you. Well, like Lisa, I'm also actually, so before I start, just a little to back up, when Beth, when you were introducing me, I realized I had sent a new bio, but Lisa had sent my old bio that had been from when I had first started in the PANS, which was 2014. So it's been 9 years, and it just, as they've been talking, I've just kind of been reflecting on my own journey, because hearing them and realizing it's been 9 years since I started in this. So, you know, I'm not going to go into my child's story or anything like that, but I do have 3 kids who have diagnoses of PANS and PANDAS, 1 PANDAS and 2 PANS. You know, since that time, I've really changed my career in order to help serve and advocate for these families and kids. And it's been like, I have to say that, even though it was incredibly challenging, it has been, it's definitely been a blessing in my life. I wouldn't have met all the people I've met. I've had amazing support along the way. I love all of the kids and families I work with, and I just feel so privileged to be able to speak to their stories and what happens for them. So, you know, I no longer work in Brookline. I did that for a very long time. And I have a private practice in Situate, and I'm actually looking out at the ocean right now, which is really beautiful. And I'm really lucky to be here. But so I just wanted to reflect a little bit on that as a parent and just as a therapist working with these kids. You know, I had specialized in CBT prior to my work with my PANDAS clients. And like Peggy said, you know, cognitive behavioral therapy is the treatment of choice, but I have found I don't actually use it all that much because symptoms wax and wane so frequently. And when kids are flaring, they are definitely not able to access that part of their brain. And so I'm just gonna, you know, Peggy, I know, talked about some of the symptoms, or the kind of the diagnostic criteria. And I too, kind of just to reiterate what we see in our clients. So obsessive compulsive disorder is, you know, I would say 90% of the kids I work with have that as their, you know, you have to have either OCD or food restriction. And I would say 90% of my clients have OCD as their, you know, some have both, but 90% have OCD. And it's not like the ritual type of or compulsions as much. I mean, definitely I do have some of those kids, and those kids are very restricted because of their rituals and compulsions. But for the most part, a lot of them are rigid thinking, perfectionism, just complete overthinking to the point where they're just immobile by their thoughts. And they can be really scary and overwhelming and just quite debilitating. So that's, you know, primarily what I see. And then there is the, you know, I see a lot of like picky eaters. So, you know, kids who started at a young age only being able to eat nuggets and fries and mac and cheese, you know, the kind of the diet of little kids. And these kids, like I have kids in high school who are like, I just don't want to eat mac and cheese anymore. Like I actually want to be able to go to college someday or live with roommates and not be eating, you know, starchy white food. Like it's starting to get embarrassing. Like they can't go out with their friends for dinner, things like that. But also like this extreme separation anxiety when a kid is flaring. And when I say a flare, it means when there's symptom exacerbation. So kids can be doing really well, have no symptoms, you know, minimal OCD or no OCD, no anxiety, but then get an infection and symptoms, you know, just ramp up to like, you know, out of control at times. So like extreme anxiety where a kid who normally would be totally fine leaving their mom just can't even get to school without either being ripped off of her or just can't get to school. And then so a lot of the kids I work with are like you know, they're these old soul, awesome, lovely kids who go into these fits of rage. It's like a light switch, like they're perfectly fine and then can just switch on a dime and become like out of control. And it's just not typical of their personality, of their character. And, you know, often these kids forget what's happening when they're in a flare or when they're raging out of control. They may like rip apart their bedroom or be throwing things or, you know, saying they're going to kill themselves or they, you know, they want to kill someone else. So it's really scary and overwhelming when this is happening for them. And obviously for the family, kids, siblings, like people in the family. And then kids also may be really regress. So I've worked with high school kids who, you know, they'll be in my office, like hugging my Squishamels because they just find comfort in things that are like younger because, you know, at home they're playing with dolls right now, even though that's not age appropriate or developmentally for where they normally are. But when they're not doing well, they revert back to things that are obviously comforting, but also like they may throw temper tantrums or baby talk. You know, one of my kids, that's, you know, I'm like, can we articulate when, you know, you're 10, please, like, let's start to articulate, but like, we'll go back to like talking like a 2-year-old. And that happens with my clients all the time. A lot of fidgeting, outbursts, poor impulse control, enuresis is big. So oftentimes, you know, kind of something that happens before diagnosis, because sometimes I get kids who haven't been diagnosed and then I'm asking all the, you know, just different questions as in part of the evaluation, and kids who have like kind of like spitting like just like piddle almost, like where they like feel like they have to pee all the time, or like can't quite make it to the toilet, like boys who can't make it to the toilet, so like leak a little bit, or girls who like mom's like, oh, I think she just has a history of UTI. She always feels like she has to go to the bathroom. But then she gets there and she doesn't have to, or there's bedwetting. So I have like 10, 12, 13, 14-year-olds who are wetting the bed, may have gone through like children's hospital, their toileting program with no results. But it only happens when they're sick, or when they're about to get sick, or if they start taking Advil for 2 weeks, then the symptoms clear up. So right, moving on. Peggy.
Yep. I think, yeah.
Oh, sorry. I didn't see it. Balance issues are really big. Like I'll often have kids, I have a balance board in my office and I like to see what it looks like. And a lot of these kids kind of just can't really keep their balance, or like their core seems to be weak, or they may have an unusual gait. And like Lisa said, POTS, her daughter has POTS, and that it's kind of not a joke in the community, but it's like, oh, pots and pans. All these kids have POTS. So, but that's the dysautonomia, where your blood pressure goes down, you get dizzy, like upon standing, things like that. And then movement disorders, sydenham choreas is part of, with strep infections. It's like this movement where you, it's like piano fingers that often happens for kids. Tics used to be part of the diagnostic criteria. They've taken it out, but a lot of the kids I work with do have tics. Sensory issues, misophonia, not being able to put on socks, not being able to like wear tight fitting clothes, needing or having to wear the same clothes every single day, not being able to shower or brush hair, things like that. A big thing I ask parents about is peeling hands or feet, because that's often a symptom of strep that people don't really know much about. And a lot of kids do have that. Chapped lips is often associated with yeast, which a lot of our kids get because of, just antibiotic use, or just for gut bacteria. There's the whole gut-brain connection, and yeast is a big thing that happens for kids. Hair pulling and skin picking. These kids, they'll be in my office just picking or picking their arms. Trichotillomania is part of it. And then again, like hallucinations and delusions, which, some kids may need to be hospitalized, but we actually try to keep them home and safe, and work with them and their families around whatever's happening for them. So, but that is, it's definitely a scary symptom when that happens for these kids. And then there's, executive functioning challenges, presenting ADHD, like, and some kids do well on, Vyvanse or Adderall, low doses of it, but it does affect organizational skills, time management, difficulty planning, processing. I may have a kid who, like a high school kid who was doing really well, they go into a flare and like literally can't, if they have a 5-page paper due, are unable to do that work because of what's going on for them. They may have a hard time making decisions. Their body's totally in a sympathetic state. They're in fight, flight, freeze often. These kids look like deer in headlights sometimes. They often will have dilated pupils, so their pupils are really huge when they're in a flare. So like Peggy was saying, so dysgraphia is really big. You saw the pictures of the handwriting, and then loss of math skills. That's, I have kids who are so smart with math and like able to do things that I'm like, I don't even know what you're talking about. And then when they're flaring, they like can't even add 2 + 2. So it's a distinct difference. But I also work with a lot of kids who, because they've had it for so long and were misdiagnosed or undiagnosed, they just don't have those abilities, or their processing speed, or it has not. They don't have the ability because of what's happened for them. So there may be work refusal, and then that perfectionism, that's part of OCD as well, where they are unable to complete work unless it's perfect. So I see a lot of erasing and redoing of things to the point, an excessive point. So for school, often we do a lot of presentations for school. So I wanted to throw in a few of my slides for school because it's important. Often these kids, will go on a 504, at least for social emotional support, or to help, like if they need to be out of school for extended time, or some kids are tested and go on IEPs because they do have processing speed changes. It's interesting to see prior to onset and then after, once they've had some neuropsych testing done, just to see the differences. And kids do lose their abilities in different areas of processing. So it's really important for them to have accommodations in school when they're flaring. I mean, when kids are doing great, I say, like, try to give them what they can. Obviously stress exacerbates things, so we don't want to overdo it, but we also want to make sure that they're, feeling capable and competent. But often kids will need like extended time on tests. They may need accommodations for writing, use of either voice to text or other, assistive technology devices, access to calculators, manipulatives, frequent breaks. Like, these kids often feel, when they're in fight, flight, or freeze, they're feeling so out of control, and having a safe adult that they can go to or be able to take a break when they need to is really important, because they're dealing with so much. Their physical health is not well, as is their emotional health at times. And so it can be really overwhelming. They may have frequent headaches, joint pain, just not feeling good, brain fog. And so being in school for 7 or 8 hours a day can be a lot for these kids. Some kids I do home to hospital or the home hospital stays because they just can't be in school. Some kids do TECA or other private online schools. Some have home tutors through the school, and we try to help kids. We advocate to get whatever accommodation kids need when they're having a hard time. I'm going to skip this one only and just kind of talk a little bit, just quickly, because we have like 3 minutes left, and I think this presentation really could be like 2 hours. So I approach the work that I do. I really use a mind, body, spirit approach, and so mind is, I do coping skills with kids. I work with parents. I do a lot of parent support because this illness really affects the families, and parents need to feel validated. They need to feel supported. Kids need to feel validated and supported. Often they've gone to many therapists, many doctors who have made them feel like they're crazy, that it's all in their head, that there's nothing wrong with them, that they just need to either suck it up, or that they're just mentally ill and need to deal with that. And so I think there's a ton of medical trauma, both with the kids and parents of this disorder. So, working with a clinician who really is there to, walk with them through this, and other, finding support. Lisa and I run a monthly PANDAS parent support group. And there's lots of families. There's too many families out there who are dealing with this. So, connecting with other people is really important. And I try to make those connections for people. Really problem solving, helping kids and parents really to reset their nervous system, because this is a marathon, not a sprint. And so learning ways of managing and, for parents, getting through every day is really hard. And I'm sure some of the parents on here can relate, given, what's going on for their kids, but really having the space to be able to take time for themselves to reset their own nervous system. Because it can be, when your kid is raging out of control, it can be really hard not to lose your mind and not to lose it with your kids. So really developing healthy coping skills. And then body, I always talk with people about nutritional support, like working with a dietitian or nutritionist who can help with the ARFID type symptoms, or at least low inflammatory diets, things like that, detoxing the body, working to really help support the immune system. So, and then, oh, Peggy, can you just go to the next slide? So this is a symptom I often, when I'm, so the mind one, I work with parents to kind of keep a rating system or a tracking system of symptoms, because when you're in it, you totally forget what's happening. And so when you go to the doctors, you might be like, oh, Johnny's fine today. But like you see the last 3 weeks of him like raging out of control, his OCD's at the wazoo, he's lost 5 pounds because he hasn't been eating, he's not in school. But like you forget, because if they're doing well, it's like, oh, everything's fine right now. So it's also good to keep track, because, and it's really hard to do, I have to say, it's not easy. But to keep track of, like, there's so many different medications, and like some medications work really well and some can actually exacerbate symptoms. So like really trying to get a handle on what's working versus what's not working is important. And then spirit, if you could just go down to spirit, and then we're going to have to end with that because I know that we're out. But again, like daily rituals for self-care, getting outside is really important. Vitamin D is, you know, I think before 9 a.m. getting outside for 10 minutes, if you can, is really crucial. And vitamin D is so good, and especially these kids who have immune disruption, their vitamin D level tends to be pretty low. And so first thing in the morning, it's actually, you know, there have been studies that show that being out in nature is actually really healing and grounding and helpful. So I often talk with families about whatever, you know, whatever their spiritual belief is, whatever, if they believe in God or if they believe, you know, whatever it is. And it's important to them to hold those things and to like create, you know, pray for themselves or have mantras, or just to have some things to hold on to get through it, because it's hard not to lose it. And then also, throwing the kitchen sink at it. I am a believer in like using all sorts of treatments like Reiki, chiropractors, cranial sacral, breath work, like all different types. Like, you know, I was a very mainstream clinician prior to all of this. And now I'm like, we're kids, we're going to the chiropractor today, or we're going to go do a flower essence. Like whatever it takes to heal my kids and to help them feel better is what I'm going to do. And that's my recommendation for families as well, because it does help. It takes a village. And, you know, my last thought would be, keep trying and keep, if you feel in your gut something is going on with your kid and it's not being, you know, validated or believed, move on, go to another doctor, go find someone who will do proper testing, and keep trying, because obviously it's worth it. So, all right. So with that, I think we have to finish up.
So
and
we
you'll
put
get
some
the
other
slides.
slides in for you to review, because of just, these are some major stressors on families: sibling dynamics, stress of marital, the physical, and the financial costs, because a lot of providers are without insurance coverage. And also just the loss of income that many parents have, one parent who cannot work because the child cannot be at home if they're not with them. And these are things parents are very afraid of, children are very afraid of. They're not heard in the community. This is a great quote about PTSD. What we were talking about recently is parents are not in PTSD. They're currently in trauma all the time. It's not post, it's current trauma that they're constantly relating and feeling. And there's manuals about why it's so multiple ways, but healing is also not linear. It's very sawtooth, like climbing a mountain, but you're going to go down as you go up. Lisa mentioned this. And then there's just some small case studies I think we're going to not have time to talk about.
Yeah, no, because we only have 5 minutes for questions
Right.
now. So.
There's the school nurse roles, infections in school, letters you can send, a sample. And then this is really important, what kids want teachers to know about their illness, particularly like, I'm not lying, my brain just won't let me do this. I try really hard and it looks different every day what I have to do. Those are really, and then our resources, including a number of thoughts and books to resource. So we're going to look at the chat questions as well as listening to them. Jessie Carrick, hi Jessie, is asking about more appropriate treatments. Actually, you can call me, we can talk more about this. And the wait list is impossible. Actually, I had to close my wait list for the moment. I mean, I have a wait list, but I don't have any current intakes. And Dr. Williams closed his ability to do most of his patients. He's doing private patients, but not the clinic anymore patients at Mass General. So there's very few of us out there left.
Yeah, and I'm hoping to become one if possible. That's why I did actually email you, I believe, yesterday or the day before.
Oh, okay, I haven't seen
and
it.
then I found, no, it's okay. And I figured you're busy. That's why I joined this, and this was really helpful. Thank you.
Yeah.
Yeah, if there's any way we could chat.
Katrina, I
more,
saw
would
your
love
head
to.
nodding and saying very much that you were hearing and understanding a lot of what we were saying. Thank you, David.
So can we get a couple of questions in real quick? 'Cause
Yeah, if
we only
anybody
have
else
2
wants to
minutes.
ask
Well,
questions.
I have a few for you.
Okay, go ahead.
One is around whether or not, can PANDAS actually go away, dissipate, or does it actually last forever? And what does it look like over the lifespan?
We
So-
don't know about the lifespan. I can say that when you have early sets of pandas like strep pandas, you will often see a history of an episode of OCD that came and went, or an episode of severe tics that just kind of diminished over time. If you get a strep infection, the antibodies raise 4 to 8 weeks after the infection. The peak of the antibodies is often the peak of your symptoms. If no more infections, if you're not vulnerable to something else, if people else around you aren't sick, because it's not just your antibodies, it's your body reacting to anybody else sick around you and creating antibodies. I have seen OCD just dissipate on its own. And tics have a known history of waxing and waning, for example. But of the kids that we see in treatment who aren't quick to fix and quick to get treatment, if antibiotics does all they need and they got somebody to prescribe it, which is the hazard that's hard to find right now, we're still dealing with very, very complex cases of kids who probably suffered for many years. And therefore, we don't really know. But I would say you go from a child who can't attend school to you go to a child who can go to college. Still maybe needing support, maybe needing a lot of the healing stuff with limbic and the emotional, the whole neurologic system. But we have a number of kids going to college and, successfully get out of their houses and stop living as if they're regressed 4-year-olds at home.
And I would like to just tack on to that with Peggy. As scary as the story was that I told about my daughter, she was able to actually move out and go to college, and she does work a full-time job. She's happy. She has a boyfriend. She did live on her own for a little while. So I do want there to be hope with appropriate treatments, and there is hope.
And I can say from my own experience, my son, he's going into high school next year. He had been not doing well at all when he was younger. He was diagnosed at 4.5, and he had been on an IEP. He was struggling academically. In middle school, he had 7 out of 9 terms. He had straight A's, high honors, is doing great. He's had some minor flares, but for the most part, he's doing amazing. And there's a lot of kids that I've worked with over the years who, with appropriate treatment, and it's not just antibiotics or IVIG, things like that. There's all sorts of ways that people are healing and getting treatment. So I have seen kids do really well and go off into adulthood and not need to be seen anymore. Or I have parents who call me or text me or email me and tell me, what their now adult kid is up to. And there are kids that are doing great. So, but we do see the sickest of the sickest kids, because those, are the ones who need longer term treatment often, and multidisciplinary approaches too.
I also didn't talk about psych meds much, but I just want to point out, this is a real dilemma for parents. They find out it's a medical issue, but they have a lot of psychiatric problems. And so psychiatric medications are still applied. They're not applied in typical dosing. If you do, they usually backfire immediately. So it is a somewhat of a skill set for somebody like me to learn how to do it correctly, or at least know what you're up against. But also, a lot of kids don't use their psych meds much when they start to really heal. We reduce them. They don't need them anymore. They might use them as a PRN. So the kind of enveloping psychiatric stuff often tends to fade away and diminish a great deal. But if you have ADHD, that's still possibly going to be there. If you have some mild anxiety issues, you're phobic about bees, I don't know that this is going to be repaired. So there are some things to recognize that are.
Well, that's when ERP comes in, or CBT can
That's
actually
true.
be helpful.
Work on it still. Yeah.
Yeah.
Or if you're phobic about needles, usually by the time but my daughter was phobic about needles and had nothing with hands until she got older and dealt with it. So, but yeah, they do recover very well, but it requires a lot of time, energy, and money often over year. And especially again, when you enter this at 14, 12, and you've been sick and then growing sick and sicker, there's a lot of dysregulation in your immune system that has to be righted. But it is not either or medical, it's both. It's both. It's medical and psychiatry that have to be somewhat involved.
Well, thank you, ladies, so much. We are at the top of the hour. Peggy, Lisa, and Melissa, so appreciate you bringing your expertise, your life experience. This was one of the most comprehensive presentations. I want to thank you for your generosity and the time and sharing all of that information with all of us. This recording and the PowerPoint slides will be uploaded to our Facebook, not our Facebook page, our website, so that families will have access to them. I know there were a number of slides you weren't able to get to there, but all of that information still will be available for all of our families to access. And I want to thank everyone else who also joined us this evening. Thank you for joining us once again to have these important conversations. And I just want to remind you, the Federation is here to answer any and all questions that we possibly can for you. We're always here as a resource. And if we can't answer the question, we will find someone who can. And one example of that is the group of ladies who are here with us this evening. So thank you again for joining us. Have a fantastic evening, and we'll look forward to seeing you again next month. Take care, folks.
Thank
Thank you
you,
so
Elizabeth.
much for your
Thank you.
support. Thank you.
Thank you.